Good morning, everybody, and thanks to the All Ireland Institute for the invitation to speak today. And I'm delighted to be able to talk about the new National Adult Palliative Care Policy. It's been a long time coming, but we're there. So this morning I'm just going to talk a little bit about the background, provide some context. I think it's necessary to see why we need a new adult palliative care policy. Then I'll talk about Sláintecare, which is our health reform strategy in Ireland, and how that ties in and underpins the National Palliative Care Policy. I'll then talk about the key recommendations and messages of the policy, and then I'll conclude with next steps, which really is focusing on implementation for 2025. Oh, I took the wrong slide there. Okay, so that is just a photo from Policy Launch, and that's the Minister for Health there in the centre, Stephen Donnelly, accompanied by staff from St. Francis Hospice. Okay, so direct from the document, that's a timeline of key developments which has led to the publication of the new palliative care policy. Without going into each year, I think certain years are definitely worth calling out. 2001, for example, is particularly significant. That was the year where the first National Adult Palliative Care Policy was published, and that policy was highly regarded internationally and indeed created a vision, a roadmap for the development of specialist palliative care services, particularly in acute hospitals and community settings with the hospice as the hub. Other significant dates, 2010 then was the National Clinical Programme for Palliative Care, but I guess the political will starts gaining traction in about 2017, where Sláintecare recommended that universal palliative care should be part of the universal health care. So that led logically then on to 2020, where it became a programme for government agenda, which meant that we now had a mandate to publish a policy. So the key steps to developing the new policy. So between 2020 and 2022, the department completed 3 key preparatory exercises. Number 1 was an international evidence brief. So this was an international evidence brief of 4 performing ranked countries in palliative care: Australia, New Zealand, Scotland and the Netherlands. And I guess the key finding from that international evidence brief was that equitable access to palliative care is critically dependent on community-based service delivery. Secondly, then, we commissioned an external review of the national policy of 2001, and this was carried out by the Trinity College Dublin Centre for Health Policy. And the report found that while progress had been made in certain areas, such as the strengthening of collaboration between the voluntary and public sector, many of the recommendations hadn't been implemented. Also, services hadn't been uniformed. So, taking account of the huge changes in the Irish health and social care system and the palliative care sector as a whole, it meant that there was a need for core recommendations to be expanded, such as general palliative care capacity and also addressing the regional variation. And then finally was the public consultation, and that was a questionnaire which was administered to interested organisations and people who worked in palliative care. Again, the outcome broadly similar to point 1 and 2, but I guess a unique outcome of the public consultation was the emphasis on the need for improved performance metrics, and that has been considered and is part of the new policy recommendations. So finally, following on from that, the Minister then established a steering group chaired by Professor Karen Ryan, and there we have a cross-section of members ranging from Voices for Care, CEOs of the hospices, and also across the department and the HSC. So why do we need a new policy? Well, this really sums it up. This is the projected need for palliative care. So the new policy takes account of the projected increase in Ireland's older population and also the corresponding increase in the number of people with life-limiting conditions. So population need for palliative care in Ireland is amongst the highest in the world, and it's set to rise steadily in the next 25 years. Some stark statistics. And again, these are conservative estimates based on 2016 census. So our ageing population of over 65s is projected to increase to nearly 1.6 million by 2051. Increased mortality projections suggest there will be an increase from 31,000 deaths to nearly 46,000 in 2040. And then studies have shown that 8 out of 10 deaths for people with life-limiting illness who will benefit from palliative care. And from the same research paper, for every one death, there's 12 other people living with a life-limiting illness who will benefit from palliative care. So the evidence points that we do need a new policy. And basically, to summarise in short, our services need to adapt accordingly to cater for that. So this is the vision of the new policy, and that's it really in a nutshell. Everyone who needs palliative care services is able to access person-centred and efficient services. And that ties in with Sláinte Care, as I said at the start. It underpins everything we do in the department, and it underpins the new policy and vice versa. And that's the 8 fundamental principles there. And I think it's important also to mention the health regions. So in Ireland, the 6 new health regions have been stood up as of 2024, and that will enable a population-based funding model to be allocated. It also involves community and acute services linked in together. So that's from the policy. That's our goal, which is universal palliative care. The House of Palliative Care, as it's called. So we have 4 strategic objectives there, aligned with 25 recommendations. So with the 25 recommendations, there are associated activities. I won't go into all the associated activities today, but I will call out some of the main recommendations, which I think are important. So this is under the Right Care Strategic Action, and we have 7 recommendations and 31 actions. And the first one there is to provide holistic care that respects dignity and autonomy. And progress is underway at the moment in this area. For example, we have a review of the palliative care support bed provision in Ireland, and the outcome of that will be in 2025 in Q1, and that will underpin service delivery in that area. Secondly, regularly assess needs and plan care. So again, this is all about advanced care planning and anticipatory care plans. Recognising and supporting carers. So really carers is at the heart of this policy and differentiates it from the 2001. And we have a review to be conducted of the palliative care hub, but also a review of short break and respite care provision. Developing our bereavement services in all settings where palliative care is provided. Again, touching on what Minister Nesbitt said, developing compassionate communities. So an example earlier was the cross-border collaboration between North and South on a compassionate community conference which took place in September. And one of the position papers being drawn up on that, and the Department of Health will consider the findings. And again, ensuring universal access. So really what that means is extending universal access to developing service design considerations for people with intellectual disabilities, for people with dementia, and also adolescent and young adults. And again, providing financial protection so nobody is incurring out-of-pocket expenses as a result of palliative care. And that extends again to kind of what Mary talked about, which was energy hardship. So, right place and right time, we have 6 recommendations, 19 actions. And the first one there is to plan and resource services according to population needs. And again, the health regions are key for this, not alone for a reform of our National Health Service, but also for a successful implementation of a palliative care policy. Also, with number 1 there, in regard to services, we have in the works 3 new hospices being built. They're at the various plan and design phase. And once those hospices are built, it then will mean that we have a hospice serving every region of the country, so that again addresses the geographical deficits in that area. Defining core palliative care services, a basket of core palliative care services. Organising services to function as integrated networks, and what that means really is developing critical enablers for the delivery of integrated care. That involves shared care records, shared summary records, basically an improved IT infrastructure, and that is catered for in the policy. Improving public understanding of palliative care, so there is a communication awareness plan for that. And to support people to be cared for in their place of care for as long as possible. So that involves developing our night nursing services and also improving our out-of-hours and emergency palliative care support. So we're on to the third one, so bear with me. There's just 2 more strategic objectives. So, as all policies, ensuring the availability of adequate numbers of appropriate trained staff in interdisciplinary teams, strengthening both our undergraduate and our postgraduate palliative care education and training, and then developing leadership capability, and that extends to having leadership representation from PPI, patient public involvement, on the National Clinical Programme for Palliative Care. Developing palliative care workforce planning capability, and I'm glad to report that the department, I'll go in later, but the department has had the funds and will be sanctioning approximately 78 WTEs to address geographical deficits in workforce for 2025. And then promoting and supporting volunteering in palliative care. So our final recommendation there is good governance. Strengthening system of governance, which involves, amongst other actions, developing and implementing a national audit of end-of-life care in the hospital setting, also developing and implementing a national guideline which is caring for adults in the last days of life, and that will be in conjunction with the National Cancer Control Programme. Developing a safety and quality operating framework for our patients. Strengthening palliative care information system again ties in with the need for a modern ICT infrastructure, and there's a clinical management system in the discovery phase under number 3 recommendation. 4, ensuring medicines are accessible and used safely and effectively. And number 5 is interesting. This is regulating palliative care service provision. So this is very much specific to the Department of Health, where we will consider a legislative framework on how our palliative care services are regulated. At the moment, hospices are not inspected by the Health Information and Quality Authority. So we will consider where it will be a legislative basis or a standards-based system, and we will look at that over the next couple of years. And again, I think it will be remiss not to talk about research and innovation given the audience here today. So we'll go just a little bit in detail on recommendation 25, which extends to our researchers here today. So listen, the Health Research Board is very much called out in the policy as a lead funding agency, and also the collaboration with the HSC Public Health Agency. Cross collaboration is recognised. But I guess the key activities, I don't have them on the slide, but one of the key activities is that there will be the appointment of integrated research and innovation fellows in palliative care. They'll be tasked with addressing really prioritised issues for implementation. A second activity associated with research is to develop and maintain the National Palliative Care Research Knowledge Transfer function. A third one is to conduct a strategic review of palliative care research and innovation capacity in 2026. And again, those findings will guide the development of the policy. I think it's important to note that the policy is an ambitious project. It's 7 years. So the strategic review is scheduled for 2026, 2027. And finally, then, is to support the development of specialist palliative care education research centres to ensure that they're fully coordinated with universities and healthcare organisations. They're by no means exhaustive relating to the palliative care research links, but I think they're the main ones that are called out in the policy. So this is quite a heavy slide regarding the implementation roadmap, but I guess one of the features of this policy is that it has a corresponding roadmap, that there is an implementation plan. At the base there, you'll see the Adult Palliative Care Policy Oversight Committee. That's chaired by the Department of Health, and we'll be monitoring progress on the delivery of specific actions. And then we have on just the left-hand side the Adult Palliative Care Policy Implementation Group. So they'll be tasked with actually driving implementation, mitigating risks, and ensuring that implementation issues are resolved. And then there will be a board report to provide the department within 6 months at quarterly intervals. Okay, so the next steps, it's getting the message out there, promoting that there's a new palliative care policy, ensuring that everyone is aware of it, establishing the HSC implementation group to oversee delivery, and also to develop an implementation plan in 2025. So we're aware that this is an ambitious palliative care policy, and the challenges of implementation are certainly common to any policy implementation. So at the top there we have resource constraints and allocation, but I'll go on, besides resource constraints, awareness and understanding. We do feel that with the implementation plan and also the government funding, that we are certainly in a very good place to get some of these recommendations implemented over the next couple of years. So 180 million for 2025 palliative care budget, that's a 16% increase in the previous year. But again, to show the government support for palliative care, it's actually an 84% increase since 2020. I think it's worth mentioning the transition of the 4 adult hospices to fully state-funded entities, particularly for our colleagues here in Northern Ireland who may be interested. So in January of this year, 4 of our adult hospices transitioned to fully state-funded entities, which now means they're on sustainable state funding basis forevermore. Prior to that, it was at a year-on-year kind of custom and practice rule. So that certainly was necessary for the publication of the policy and for a successful implementation. So that is fantastic that that is actually now forevermore in stone. So just a summary, just to echo some of the points: improving public awareness and understanding, developing a trained workforce to deliver integrated palliative care. And as I said, 78 WTEs have been sanctioned for workforce which relate to specific policy initiatives in 2025. And then again, developing the required palliative care infrastructure, which extends to development of a modern IT infrastructure. That's it. Thank you very much.